Hey, this is Jerry.
This is Lillian.
Hey guys, this is Ben, and we're going to be covering pediatrics in this video. So we're going to be covering the respiratory system, the circulatory system, the nervous system, the gastrointestinal system, the musculoskeletal system, and some unique medical conditions and patient assessment of a pediatric. So here we go. These are the anatomical differences, and the question is, how much have you changed since you were a baby? Alright, so the respiratory system, you have a smaller airway in diameter and shortness in length. Lungs are smaller. You have a proportionally larger tongue. This can lead to airway obstruction. You have a long, flappy U-shaped epiglottis. When you're younger, you're a nose breather. You have an oxygen demand that is twice that of an adult. You have thinner chest walls. Respiratory issues are the leading cause of pediatric cardiopulmonary arrest. The cartilage rings of the trachea are less developed. Trachea is about the size of a drinking straw. Vocal cords appear to be non-existent. The heart is located higher in the chest. It is common for infants to breathe 20 to 60 times in a minute. The upper airway is narrow and shaped like a funnel. You have thinner chest walls. Muscle fatigue from breathing hard can lead to respiratory failure. So this is the circulatory system. An infant's heart can breathe upwards of 160 times a minute, um, and they have the ability to constrict blood vessels, which helps compensate for decreased perfusion. And the tables to the right, the one on top is pulse, and as you can see, infants have a very high pulse from 100 to 160. Toddlers coming down just a little bit from 90 to 150. Preschoolers, again, just another step down, 80 to 140. School age, which is that's elementary to middle school. They have a pulse of 70 to 120. And adolescents, which are middle school to teenage, or middle school to 18 years old, they have a pulse of 60 to 100. And then again, breaths is the table at the bottom. And again, it's just the newborns breathe really fast, 30 to 60. Infants down just a little bit, 25 to 50. Toddlers, again, another step down, 20 to 30. Preschoolers stay about the same, it's 20 to 25. School age is 15 to 20, and that's where your breathing rate, or sorry, not 15 to 20, adolescence, which is 12 to 20, and that's where your breathing rate kind of plateaus and becomes.
Okay, so the nervous system. Infants' nervous system is underdeveloped, immature, and not protected. This makes them more susceptible to be getting sick. The occipital region of the head is typically larger. The head to body ratio is larger, which makes them a little top heavy, so they can be prone to like head injuries if they fall. Brain tissue and cerebral vasculature are fragile and are prone to bleeding from force. The brain requires more nutrients. An altered mental status may result from hypoglycemia, hypoxia, seizures, ingestion of alcohol or drugs. The parent is an important resource for information because
Alright, so the musculoskeletal system. Uh, open growth plates. They have open growth plates. The bone on the head of the infants are not set yet, so they have a soft spot in the back of their head. The thoracic rib cage is very elastic. The bone begins to grow during adolescent age. Older children have the chance of a long bone fracture. So these are the unique conditions, things that happen with infants and their signs and symptoms and treatment. Alright, so asthma, it's the most common illness. Signs and symptoms include wheezing, cyanosis, and it can lead to respiratory arrest. So what you want to do is put them in a tripod position if you can. You want to give them oxygen, and if they have it, a bronchodilator, via metered dose inhaler. Manage airway if needed. So croup is most commonly seen in children from the age of 6 months all the way up to the age of 6 years. there's not too many signs and symptoms, just a headache and fever. And the treatment is to keep them comfortable and calm. And you want to give them oxygen via blow-by. So you don't want to strap a mask on these kids.
Okay. Epiglottitis, we would usually assess them similar to the croup. It's more common in adults, but it's also seen in typically 3 to 7-year-olds. Signs and symptoms include sore throat, fever, stridor, or difficulty swallowing. We would typically administer oxygen, make sure their airway is clear, because our main concern, and we would insert an oropharyngeal or a nasal pharyngeal if needed.
Alright, so febrile seizures assessment, it's most common in ages 6 months to 6 years. It's caused by fevers and it lasts less than 15 minutes. You want to support the ABCs, give them oxygen. If they're still seizing when you get there, you want to move everything away from them so they don't hit anything. You want to cool the patient down.
So meningitis is caused by infections. If it's left untreated, it can lead to permanent brain damage or even death. Some of the risk factors include being male, newborn, or geriatric, having brain or spinal cord or back surgery, or having a head trauma. Signs and symptoms include fever, low level of consciousness, or pain and movement of the neck. And our treatment is oxygen administration, and you want to transport them to a hospital.
Okay, so sudden infant death syndrome is the leading cause of deaths in infants younger than 1 year old. Risk factors include a mom that's younger than 20, a low birth weight for the infant, or if a mom smokes during pregnancy. Our treatment would be to basically just assess the scene, assess and manage the patient, and communicate and support the family as much as possible. Since the infant is already dead upon arrival, we can't do much for them besides just assess and support.
Alright, so airway obstruction. Children are prone to airway obstruction because of their large tongue. Infection can cause airway obstruction such as croup and epiglottitis. Some signs and symptoms include wheezing, crackling, ineffective coughs, cyanosis, and a low level of consciousness. Treatment would include, you want to encourage coughing, provide oxygen, and clear the airway if needed. Then if you need to, do a head tilt chin lift.
Poison, just it's the signs and symptoms are dependent on the substance, which are the same as if they were an adult, but it takes much less of that substance to cause signs and symptoms. Here are some common sources: iron, prescription drugs, street drugs, and vitamins. Now, hopefully no parent is giving their baby street drugs, but you never know. So you want to assess the ABCs, and you want to stop the patient from exposure to the poison. So if it's like a powder or something, you want to clean the patient off. You want to make sure that the exposure stopped. If it's like carbon monoxide, you want to remove them from the environment where they are being exposed to carbon monoxide. And if if the patient develops signs and symptoms of shock, you want to transport immediately.
Alright, so abuse, you want to ask yourself, is the injury typical for the age? Is it inappropriate? Do they have severe injuries? Is there unexplained level of consciousness? For treatment, you want to treat the injury that they have already, and you want to report abuse or suspect.
Alright, so here we go. Patient assessment, steps to treat a baby and or child.
Okay, so for the patient assessment, when you are dispatched, you should prepare for a child, so make sure you have the correct size equipment and pregnancy kit. The scene size up is the same as normal. Primary assessment, you get your general impression of the patient. Use the ABCDE or the PAT, and the PAT is the Pediatric Assessment Triangle, which focuses on 3 main points, which are appearance, works of breathing, and circulation. ABCDE covers airway, breathing, circulation, disability, and exposure. The PAT requires caregivers to remove some part of the patient's clothing for observation. If the child is less than 40 pounds or in a car seat, transport in a car seat unless spine immobilization is needed. It's typical history, but directed more towards the parents, so you'd be asking them. Secondary assessment, infants, toddlers, preschoolers assessment should start at the feet and you'd work your way up. The BP formula for children less than 10 years of age would be 70 plus 2 times the child's age in years equals their systolic blood pressure. For children younger than 3, assess abdomen for respiratory rate.
Well, that's the end of the video. Thank you for watching.
Thanks for listening.
Bye everybody.